Thank you, Nancy. Another question? Another question? Okay, great. Let me start with Nancy's question. So Nancy asks, what is the assurance that you'll be able to get the dose in terms of the 12 weeks that we've talked about? And are we better off in getting one dose? One, it's important we understand, and I think this is also related to Zainab's question. Kenya got into an agreement with what is known as the COVAX facility. And we did this with a number of countries. So we came together and grouped together and therefore purchased together. And so the availability of vaccines up to that point was contingent on the supplies from the COVAX facility. We're in discussions with them. Every other day we're engaging COVAX facility and the members therein to make sure that at the end of the day, that Kenyans will be able to get their dose at 12 weeks' time. Right now, all points indicate that that will be the case, that we will actually be able to get our doses up to the point of 12 weeks. Should that not be possible, and like I've said, right now all indications, remember COVAX did sign an agreement with the countries, and so there's an expectation that they will meet the agreement. Should that case not be, we are in discussions to see where else can we be able to source and get these doses to ensure that if you got your first dose as Astra, you still get your second dose at week 12 as Astra. So we are in discussions to ensure that this happens. Again, also, we are diversifying. In the beginning, we started with COVAX, but we are recognizing that there are challenges there, and so we are diversifying, talking to Africa CDC, having bilateral arrangements with these pharmaceutical companies to be able to ensure at the end of the day, we spread our risk and that we can actually get enough doses for the population in the country. In terms of wastage, there's always wastage in any vaccination exercise, be it BCG, be it polio, be it measles, be it when you take your child to the facility for DPT, there is always a calculation of wastage. And so what we did, even as we have our doses here, we've been able to compute that in terms of ensuring we have our 1 million doses and account for a percentage, a margin of wastage. But I think Dr. Akwale is best priced here to talk about that issue in terms of what is our current wastage. In terms of leadership, I can tell you, and I was proudly sharing this with Waziri, Kenya is probably number 7 in the whole world in terms of vaccination. I don't know if you all knew that. We're actually on the leaderboard of vaccination in the world. If you look at that, and that's data and statistics that we can share with you. So we're actually proud of what we've done as government, what we've done as a ministry, and most importantly, what Kenyans have done in terms of coming forward and, accepting the vaccine and being very enthusiastic about getting the vaccine. And so for those who may have criticism, we always say we welcome any criticism. It can refine us, it can make our game better. But right now we're very proud, as I said, we're number 7 on the leaderboard and we intend to climb that leaderboard. And we are happy with what we're doing as government. In terms of a question on what's happening in the counties, yes, the COVID situation continues to be dire. We've had engagements with COG where different county governments have reported increase in numbers of admission. We have some county governments who say they do have constraints when it comes to the number of beds. And so we are continuing, one, to run our home-based care program. Today, you've seen we have 6,800 people in that program. If we did not have that program in place and actually succeeding in running that program, it would mean these 6,800 people would be in a facility somewhere. therefore causing more pressure to that facility. So one, we'll continue running this program, continue assessing the patients, and ensuring that counties are actually able to effect the home-based care program. Number two, challenges that are present when it comes to oxygen are being addressed. We've gotten into discussions with different partners. Very soon we shall be able to ensure that this commodity is availed and is accessible across the country. So there's good progress happening there. In terms of ICU facilities, we are continuing to run ICU trainings with the healthcare workers who are in the counties to give them that capacity to be able to run those ICU beds and provide care. And I'm pleased, I've seen several governors, emerge as champions in terms of COVID-19, and we continue to collaborate with COG in ensuring that the situation does not get to the tipping point. So far, so good, as we continue to ensure that, we're able to manage the situation. As mentioned today, positivity is at 12.4. So again, we're not out of the woods. And we can say as a ministry, particularly in the red zone, we've seen more adherence to masking, we've seen more adherence to hand washing. So we continue to thank the public for that, adherence to the measures and continue to encourage it. I think those are the main questions, but perhaps Dr. Kwale, you can provide a bit more information on the issue of AstraZeneca and the wastage of doses. I think you can come in and we'll have to share this. I have to sanitize this for you.
Okay.
Yes. So good question. When do we expect the second consignment to come in? Right now, we do not have a date. And it's important we understand that it's not only Kenya that doesn't have a date. It is all the countries who are in the COVAX facility who do not have a date. Right now, members of COVAX are in discussions to see. I'm sure you've seen in the media that there's been a breakthrough in some areas and there might be some 60 million doses coming. We still do not know if those 60 million doses will come to Africa or if they'll go to other countries. However, I can tell you every day, in and out, we're in discussions with COVAX to ensure that we get our doses here at least within that 12-week period. So we don't know. Nobody knows that date.
Okay.
Yeah, thank you, Cass. I think the issue of shortage, let me try to explain that. In fact, in Kenya, I think we are going to have efficiency. We'll vaccinate more people than the doses we received, and I'll explain why. So in the planning stage, you cater for wastages. But then during implementation, there are also efficiencies which are gained because a vial of AstraZeneca, for example, is supposed to get 10 doses. But the manufacturer can increase 2 doses, or some vials may be reduced by 2 doses. So 10 is an average. Now what we've realized, the reports we are getting, very often we are able to vaccinate 12 people, in a few cases 8. Now the time you are able to calculate your wastage is when a facility actually has used all the doses. Then you calculate how many people were vaccinated by that. The reason I think we may get efficiency, last week if you look at our data, a county like Nyeri, which had used all their doses before replenishment, had vaccinated more people than 100%. So you may see some may get 100, some may get close to that. So it will be until the distributed vials are fully used, that's when you can know what the wastage rate will be. But from where I sit, we are likely to get efficiency more than wastage. Now, some leaders are not happy. I wish that question was more specific. Then we would address. And as Kasmangange said, yes, every country has had challenges in the deployment. And as the issues come, we look for solutions. The biggest challenge right now is global shortage of the vaccines. It is not a matter of money. Even if you have all the money, even some of the richest countries now have no vaccines. Of course, in Africa, the impact is a lot. Some countries have actually stopped vaccinating. You may also know that some countries have actually not started vaccinating because they have no resources. So for Kenya, even if you look last week, we were the 3rd best performing in terms of reaching per 100 population with vaccination, after Morocco and Botswana. So in terms of pace, in terms of efficiency, we are doing well. Now, the issue of 12 weeks, just to emphasize, it is not only Kenya that is pushing the second dose to 12 weeks. It is a recommendation by WHO. Other countries have done that. There will be no public health arm for you to get your vaccine dose at 12 weeks. It is still with a recommendation, and indeed, the science has shown that the immune response, the way your body will react to it to offer you protection, is better than if it is done at 8 weeks. Now, the issue of the COVAX, just to add one thing, we are waiting, and as Kas Mwangangia said, we are in constant discussion with COVAX on a daily basis. Last week they told us during the month of May, they will get 65 million doses outside of the India manufacturing. But now we are asking them how many are likely to come to Africa. So once we get the information, we will let Kenyans know. But really also assuring that the second dose will be from AstraZeneca. Pfizer and Johnson's will come to vaccinate other Kenyans. And from Monday, the task force that I chair is going to lay out strategies for multiple vaccine introduction. Because we are going to have AstraZeneca, we are going to have Pfizer, we are going to have Johnson & Johnson. So we will be working, revising our deployment plan to consider that multiple vaccine deployment in Kenya. Thank you.
So thank you all. See you tomorrow.